Good day, everyone. I'm Izy Blam from Group 2A. Together with me are Bea Caayon, Peah Caldea, and Catchete from BSN-PC. And today, we're going to present our thesis entitled Peer Pressure and Educational Stress Among Nursing Students. Stress can be defined as a state of worry or mental tension caused by difficult situation. Nursing education is marked by high pressure environments, including rigorous coursework, and clinical rotations, which significantly impact student stress level. The purpose of this study was to determine peer pressure and educational stress among nursing students. For research design, the study employed quantitative descriptive approach. This approach determines the relationship between dependent and independent variables within a population. For data collection, the researchers utilized a survey method in a face-to-face setting by asking questions through an adapted survey questionnaire.
For the participants of the study were the Level 1, 2, 3, and 4 nursing students in the second semester for academic year 2023-2024. The nursing students population is 906 from Level 1 to Level 4. The researchers used stratified random sampling, which divided the population into smaller random subgroups known as strata. Computed the sample size of each stratum: 73 students in Level 1, 57 students in Level 2, 65 students in Level 3, and 82 students in Level 4.
For the instruments, the survey questionnaire was adopted from the questionnaire of peer pressure questionnaire revised and educational stress scales for adolescents with minor revisions. The part 1 is the demographic profile, the part 2 is the peer pressure questionnaire, part 3 is the educational stress questionnaire, and for the validity score, we have 4.75 using good and skates, and for reliability test, we have 0.936 using Cronbach alpha test.
For the results, first is demographic profile of the participants in terms of year level. It is evident that level 4 is the most prevalent at 29.6% individuals represented, suggesting that students closer to graduation may face higher stress levels due to increased academic and clinical responsibilities. This is followed by level 3, level 1, and level 2. In terms of sex, a majority of 73.3% are female, indicating a significant demographic that may experience stress differently. The remaining 26.7% are male. In terms of age, 46.6% of the participants are below 21 years old, indicating a proportion of young individuals. The remaining 53.4% are 21 years old and above, suggesting a balanced distribution across age groups. Next, participants' level of peer pressure when grouped according to profile variables. In terms of year level, students in all levels reported low levels of peer pressure. In terms of sex, males with a mean of 1.85 and females with a mean of 1.75 reported low levels of peer pressure. There is a slight difference in means, with the males reporting higher average level of peer pressure than females. In terms of age, both groups reported low levels of peer pressure. As a whole, the average level of peer pressure reported by all participants was low, with a mean of 1.79. The slight variations in peer pressure based on year level, sex, and age suggest that the stimuli or the peer pressure are consistently low. Overall, the data suggests that nursing students are effectively managing peer pressure, thereby minimizing its impact on their educational stress.
So for the participants' level of educational stress when grouped according to the profile variables, first is the year level. We have the level 2 with the highest results with a mean of 3.92, and in conclusion, level 2 students experience higher stress levels and may be still adjusting to the demands of hospital duties. It is a significant increase in educational stress due to the abrupt transition of theoretical learning in a classroom setting to practical application of clinical practice in a healthcare environment. Next, for the sex, both fall on the moderate educational stress range. In conclusion, educational stress affects individuals regardless of their gender. And lastly, for the age, below 21 years old and above 21 years old, both experience moderate stress levels. And in conclusion, this is found that majority of the student nurses experience moderate stress.
For the different level of peer pressure when grouped according to year level, There is no significant difference in the level of peer pressure of students when grouped according to year level, H value of 0.915 and P value of 0.822. The P value of which is 0.822 is greater than the significance level of 0.05. In statistics, a p-value greater than 0.05 means that observed difference is likely due to chance. The null hypothesis is not rejected at 0.05 level of significance. In simpler terms, students from level 1 to level 4 seem to face comparable pressure from their peers, regardless of their specific year in school, according to the study conducted by Pacheco Castillo et al. 2021. For a different level of peer pressure when grouped according to sex and age, the table 12 shows that there is no significant difference in the level of peer pressure of students when grouped according to sex. Therefore, the null hypothesis is not rejected at 0.05 level of significance. The result indicates that students when grouped according to sex and age are statistically experiencing the same low level of peer pressure. It divides participants into male and female groups, then compares those under 21 years old and those 21 and over. The table looks at mean rank, a statistical measurement used to compare groups, and finds no significant difference in peer pressure between males and female, according to the study of Graves et al. 2021. There is also no significant difference in peer pressure reported by those under 21 and those 21 and over.
Difference level of educational stress when grouped according to year level. There is a significant difference in the level of educational stress of students when grouped according to year level. Therefore, the null hypothesis is rejected at 0.05 level of significance. This implies that there is a need to address the situation by implementing stress management activities in all year levels. For the post hoc test in the level of educational stress when grouped according to year level, the post hoc test that was used was 2K-HST, which the results indicate that there were significant difference in educational stress levels between different academic levels. Level 2 students experienced more stress compared to level 1, level 3, and level 4. However, level 4 students have lower stress levels compared to level 1 and level 3. Level 1 and level 3 experience the same educational stress level.
For the different level of educational stress when grouped according to sex and age, for the sex, it indicates that students in both sexes have statistically the same experience of having a moderate educational stress. For the age, there is a significant difference in the level of educational stress of students ages below 21 years old are experiencing more educational stress compared to the ages below 21 years old and above. In conclusion, Roy's nursing theory, the adaptive response of an individual is influenced by their developmental stage. Individuals in different age groups may have varying capacities for adaptation and may respond differently to the same stimulus. For the conclusion, the findings indicate that nursing students generally experience low level of peer pressure but moderate levels of educational stress, with level 2 students experiencing the highest stress. However, targeted support for stress management, particularly in level 2, is recommended. The higher educational stress, reported by younger students and females, highlights the need for targeted support in these groups. The consistency of peer pressure across year levels, sex and age suggests that nursing programs successfully provide a supportive environment.
For the recommendations, College of Nursing administrators to implement stress management programs, create supportive learning environments. For the nurse educators, foster support, provide stress management resources, and advocate for academic support services. Next is for the guidance counselor to offer tailored counseling and resilience building workshops. For the nursing students, they are encouraged to seek support and develop coping strategies. And for the parents and guardians, should foster open communication and involvement in their child's life. And for the future researchers, suggestions include exploring specific stressors faced by nursing students. That is all for our presentation. Again, we are the Group 2A of BSN 3C. Thank you so much for listening.